Testosterone is a female hormone. Women have actually 10 times more testosterone than estrogen.
You mentioned testosterone. Why is testosterone not just for men?
Oh yeah, testosterone is a female hormone. We have a significant more level of testosterone than estrogen. When we look at our circulating levels of hormone, so we're most abundant with progesterone, then DHEA, then testosterone, and then estrogen. And so we think, okay, when we look at graphs just emphasizing the important hormones, progesterone and estrogen, how they change over time, we give estrogen a lot more weight. And it's true, it's important, but really we need to be giving the precursor to estrogen, and that is testosterone, a lot more weight. And whereas estrogen maintains bone, testosterone builds bone and builds muscle. And so we can't leave that out in the bioidentical hormone replacement therapy equation.
Stress and cortisol levels are often overlooked when we're discussing bone health. Can you share how chronic stress is impacting our bones?
Yeah, so I think the important thing that I learned.
If you haven't done so already, go ahead and click that subscribe button down below. It's a little red button. You punch that, and it's going to notify you every time we put out a new episode that can help you improve your bone health. And then also, if you haven't done so already, head over to bonecoach.com, sign up for the free 7-day osteoporosis kickstart. That's going to walk you through everything you need to be doing right now to get on the path to improvement and stronger bones. After you do those two things, go ahead and press play on this episode, and I'll see you inside.
Welcome to this episode of the Bone Coach Show. Joining us today to explore hormones, menopause, and bone strength during and after is Dr. Anna Cabeca. Anna Cabeca is the best-selling author of the Hormone Fix and Keto-Green 16 and MenuPause. Dr. Anna is a triple board certified and a fellow of gynecology and obstetrics, integrative medicine, and anti-aging and regenerative medicine. She holds special certifications in functional medicine, sexual health, and bioidentical hormone replacement therapy. She lectures frequently on those topics and shares the secret behind the ebb and flow of intimacy as she demystifies the fascinating hormonal changes over time. She'll help you discover how the love hormone, oxytocin, can breathe life into your relationship, and how cortisol can take it away, and how the delicate balancing act of those hormones can reignite your libido and support a healthy relationship, most importantly, the one you have with yourself. She is a sassy, blunt, speaks from the heart, and has a wonderful sense of humor. And this is why we call her the girlfriend doctor, because everyone needs a friend like her. She has personally developed natural products to help women balance hormones and thrive through menopause, including the highly acclaimed Julva cream for the vulva and MightyMaca Plus, a powerful superfood blend. She lives in Dallas with her daughters, horses, and dogs. Dr. Anna, welcome to the show.
It's so great to be here with you, Kevin. Thank you.
It's good to see you again. Well, so Dr. Anna has been on the show before. We did a podcast in the past, and we see each other at conferences and other places, and it's time to reconnect. And there's some updated information and new things we can share with the audience. And I think this is going to be really important for everybody to listen to the end. So it's great to have you back.
Yeah, it's great to be back. And I've enjoyed having you in front of my audience too. So really good.
Well, let's start off with, I know you emphasize the connection between hormonal health and overall wellness. Can you explain how hormonal imbalances might impact bone health, particularly during menopause? Because a lot of the people in our audience, either they have osteopenia, they have osteoporosis, or they saw a mother, grandmother, someone who had that, and they're wanting to prevent as they're either in menopause or post-menopause. So I'd love to hear.
Yeah, so hormonal therapy, we think of, first of all, empowering our body's own natural hormone production. And that is key to having healthy, strong bones from a young age, and decreasing things like inflammation, which work against us. So I would say two key reasons for disease is hormone imbalance and inflammation. And when you look at that with a third, and this is like I say, the devil's pitchfork for women's health is adrenal dysfunction. And that high cortisol, high inflammation, that is going so far to destroy our health. And in gynecology today, there's emphasis on, a lot of emphasis on estrogen for bone health. And I think what I really want people to know is that while estrogen can help maintain bone, we have other hormones that help build it, and build it in a strong and flexible way, like progesterone, pregnenolone, DHEA, testosterone, that these hormones are powerful in creating strong, healthy bone. And I want to give an example because I actually just read a DEXA scan for one of my 69-year-old patients that I've been managing for over 15 years now. And at 69 years old, her bone density is positive. Like she is a plus for lumbar spine plus 0.5. And for femoral neck, which is where most bone fractures occur, it was like plus 0.7. So maintaining healthy bone where her peers are at osteopenia, osteoporotic levels. And the hormone therapy, the nutrients, the adaptogens that she's been committed to for the last 15 years has really helped her maintain strong, flexible bones. And she's like at risk, thin white female with history of thyroid. And so she's been at risk. And contrary, I had a young woman, 46 years old, in my practice with osteoporosis at a negative 2.7. And if we waited for bone density testing till, she had a fracture or was of, the age where your insurance allows you to do it, she would be so fragile. And I think this is where I want people to understand we have a lot in our doctor's bag now, if we've focused on the research and fixing it, that really helps us maintain our quality of life and our physicality as we age.
So often, and thanks for sharing the specific examples there. So often what I see with people is they might go to their conventional doctor, and the doctor, even if they are an osteopenia, the doctor may just say, oh, well, we'll wait and see. We'll wait till your next bone density scan till you get to osteoporosis, and then we'll put you on a medication. But there are preventative things that we can do to actually prevent you from even getting to that place in the first place. So I know you just talked about hormones. Can you talk a little bit about the prevention side? If we see somebody that might be on the path to that, or has a family history of it, or the likelihood that they're going to go in that direction, what are the things that you want to see them doing?
Yeah. So first and foremost, it's like for me, the platform I built around lifestyle and nutrition changes. Okay, it's my Keto-Green method. So it's low glycemic. We want a nutritional diet that is low glycemic, that is rich with a good, alkalinizing nutrients like our arugula, dandelion, parsley, broccoli, sprouts, cabbage, these that also are in the cruciferous family that help with healthy estrogen detoxification and the gut microbiome. So low inflammatory, nutritious, alkalinizing components with high, good, adequate protein intake and healthy fats, but low glycemic. So we want to reduce inflammation. I want to look at key markers like vitamin D level, adrenal level through the DHEAS marker, HSCRP for inflammatory marker. And there's so many more, but the hemoglobin A1C is another one. So as a hormone doctor, those aren't necessarily other than DHEA hormones, but those are some hormones that I want to look at. And then also I'm looking at if they're still cycling, cycle day 2 FSH to estradiol. And if they're postmenopausal, I'm watching their FSH, and this is where I kind of deviate from standard. I just lectured at Harvard's Women's Health and Menopause week-long course, their first menopause course they rolled out. I was the only integrative medical doctor, and there was a general census among many of the providers that you don't test even if they're on hormone therapy. But FSH, high levels of FSH are associated with bone turnover and bone loss. So if we're not monitoring that FSH and really working to optimize it, they're on hormones, but they're not adequately managed on hormones for bone protection, and they're continue to lose bone. They're not optimized. And so those are some key markers that I look at and ways nutritionally. And then, of course, using adaptogens. For me, my foundational adaptogen is MightyMaca Plus, that 30 superfood combination that has so many ingredients in it that help with the natural anti-inflammatory pathways. So we can decrease inflammation, support adrenals, promote, healthy metabolism, then we're maintaining both. And I make clients check their urine pH. So I'm like, okay, check your urine pH. It's a biomarker like heart rate variability and your blood pressure. That's so important as we age that we really don't look at it. And it does help us know how we're interacting with our environment nutritionally as well as mentally, because stress increases urinary acidity. Cortisol increases urinary acidity, and higher levels of cortisol are associated with increased bone loss and muscle degradation, all the things with age, wrinkles and hair loss and things we don't want as we age.
You just listed off a few tests that you like to look at, vitamin D, HSCRP, different hormone levels. Can you share a little bit about where you like to see some of those levels at for people?
Yeah. Yeah. For hemoglobin A1C, ideally at 5.0, definitely less than 5.3. So we really work to get the hemoglobin A1C fine-tuned. Vitamin D levels greater than 50 to 80 in that range. Typically, we'll look at a vitamin D25 hydroxy and want to optimize it in that range with lifestyle, getting early sun exposure on, to your eyes, to as much skin on your body as possible, to get a lot more than vitamin D from the sun. And it can be, let's say, a potent mitochondrial stimulant to help with metabolism and hormone balance. But also, it really does help with decreasing inflammation. So we look at this early sun exposure and then supplement on top of that with vitamin D3, K2 combination. So look at that vitamin D level. And then HSCRP less than 1. And we want to make sure that's nice and low. And also then the DHEAS level for women greater than 150.
And if you are seeing someone whose levels are off or they're low, for example, like somebody has low vitamin D, and you're saying, hey, go out and get some sun, start supplementing with vitamin D, how far out are you having them retest again to look at those levels to see if the intervention they're making is actually working?
6 to 8 weeks.
Great.
6 to 8 weeks.
So that's
3 days after their last dose.
Great. So that's for anybody listening, 25 hydroxy vitamin D tests. You can go through your practitioners and get those. You can go to labs outside of there and get those. But it's really important, I think, when you test something, the level is not where it needs to be, that we actually, whatever intervention we're going to make, we then retest to see if that intervention was actually effective.
Yeah, absolutely. And then when it comes to the hormone markers, again, we talk about a postmenopausal woman. When we get into reproductive age, it's the day of the cycle that we look at. But postmenopausal is, when we look at the menopausal woman, we want to look at an FSH level and drive that down. Definitely, again, it depends, because you want to look at these other markers too. And sometimes it can be really hard to drive down that FSH, but FSH below 40, preferably below 20. And oftentimes I see clients that have been on hormones, but their FSH is in the 60s, 80s, 100. I'm like, okay, you're, that's a risk for dementia, and that's a risk for osteoporosis. We need to do better. And it's not just estrogen. I think this is where the confusion is. It's not just estrogen that works to lower FSH. We have to use these other hormones, adaptogens, lifestyle, et cetera. And again, it's so fascinating as the more I dig into this follicle stimulating hormone, FSH for short, that I think it's misnamed. It has so much, there's so many endocrine roles.
So you see situations where the person is on hormones, but their FSH is not where it needs to be. What's happening? What are you doing in those situations to help the patient get to where they need to be?
Yeah, it really depends. I want to look at what's going on. You know how I always say it takes more than hormones to fix our hormones. But in these clients, I want to look, okay, can we optimize progesterone more? Can we add in testosterone more? Or the way they're absorbing the hormone or use of it, do we need to look at other modalities, intravaginal, transdermal? What do we need to do safely for oral, and where can we use the oral progesterone, bioidentical? And when I talk about hormones, I'm only talking about bioidentical hormones, not synthetic. And then testosterone too. What are they, if we're using it in a troche, a lozenge, or vaginal or transdermal, are they absorbing it? So we want to look at those ways to optimize. And then the adaptogens, like maca, for instance, phytoestrogens can help. A low inflammatory diet is key. What's interesting, Kevin, I'm curious if you've seen this too, but I have a client, this one young woman who had long haul COVID, post 5 vaccines, and then 2 times COVID, and then she was long haul COVID. So I saw her in July of 2023 initially, and she hadn't been able to get out of bed. Young 44-year-old Latin American woman or South American woman. And so part of that workup was completely reversing, healing from the long COVID, getting good energy and all that good stuff. We did a bone, but then through this, she'd also become menopausal, so perimenopausal, menopausal, as I think a multitude of factors that caused her to really early transition into menopause, one being the chronic COVID infection. And the second was when I did a bone density scan, she had significant osteoporosis at her young age. And under the surface, there's this histaminic reaction. So here I've worked to optimize her hormones, get them better, had driven down FSH, continue to fine tune her hormones as we look at the urinary telopeptides, the bone turnover, to reduce that, got that nice and low. But then she had a histaminic reaction, MCAS, and her FSH skyrocketed to over 100, even though her hormones, her estrogen and progesterone, testosterone levels were better. Her FSH skyrocketed with that histaminic reaction. And I thought that was fascinating because it's not described it's not common medical knowledge at all that this is even a possibility. Those with these type of allergies, histamine reactions, that it is an MCAS, mast cell activation syndrome, is a culprit to increase, and her bone turnover skyrocketed again, even though her hormones were improved.
Absolutely. There is a massive connection between the two of those. If you have too much histamine, that's going to lead to more bone breakdown, more bone resorption. We see a lot of people that come to us that have issues with MCAS and histamine issues too. So that's one other thing that I think is important here is you mentioned testosterone too. And why is testosterone not just for men?
Oh yeah, testosterone is a female hormone. Women have actually 10 times more testosterone than estrogen. We have a significant more level of testosterone than estrogen. When we look at our circulating levels of hormone, and this is something I mapped out as in the same unit, so we could really see circulating levels of hormones. So we're most abundant with progesterone, then DHEA, then testosterone, and then estrogen. And so we think, okay, when we look at, graphs, and I've been guilty of it too, just emphasizing the important hormones, progesterone and estrogen, how they change over time, we give estrogen a lot more weight. And it's true, it's important, but really we need to be giving the precursor to estrogen, and that is testosterone, a lot more weight. And whereas estrogen maintains bone, testosterone builds bone and builds muscle. And so we can't leave that out in the bioidentical hormone replacement therapy or replenishment therapy equation.
Yeah, I completely agree. I'm glad that you closed the loop on that for our audience, because sometimes I'll still hear people say, oh, that's a male hormone, and that's not the case. So it's still important for women too. Let's talk about stress and cortisol levels. Stress and cortisol levels are often overlooked when we're discussing bone health. Can you share how chronic stress is impacting our bones, and then what strategies you recommend to manage it? Hey, it's Bone Coach Kevin Ellis. I want to take one more minute to talk about if you are somebody who was newly diagnosed with osteopenia or osteoporosis, and you're at a point where you're stressed, you're worried, you're overwhelmed, you have no idea where to start or how to get started getting confident in your plan. I want to tell you about the Stronger Bone Solution Program. Over 5,000 people have come through the Stronger Bone Solution Program, and it walks you through the exact process you need to fill in the missing pieces, uncover critical things in your plan that you may not be aware of, and help you make modifications, adjustments, and tweaks to get you to the place where you're building stronger bones. I want you to get confident in your plan so that you can focus on living life and enjoying the life that you deserve with the people you love most. So if that's where you want to be, head over to bonecoach.com/apply and apply for our Stronger Bone Solution Program right now. I'm Bone Coach Kevin Ellis. I want to see you inside this program. I want to help you get on the path to improvement and stronger bones. Hope to see you inside very soon. Let's get back to the episode.
Yeah. So I think the important thing that I learned through my own journey, and I'll share a little bit of the story, is that when I was mid-40s, I was going through my second menopause, a perimenopausal, experience, the brain fog, mood swings, crazies, whatever you want to call it, and the weight gain without doing anything different. That's when I really worked to discover what I call my Keto-Green method. And part of that is when I restricted carbs completely, I really started not liking how I felt. And I say, okay, going keto crazy a little bit. And what I did, I checked my urine pH, something as a functional medicine doctor I would tell my patients to do. And my urine pH was as acidic as the urine pH paper read. So basically, I was peeing acid. So just think, like, just structurally, if you have acid in a container, the bladder, for instance, for a long period of time, isn't that going to worsen bladder health, increase susceptibility for infections, incontinence issues, interstitial cystitis issue over time, something that is 85% of postmenopausal women experience incontinence. So shouldn't we be looking at that and thinking, so first of all, I'm like, I'm peeing acid. This isn't good. Secondly, I'm like, okay, this acidity is related to, we know a low urinary pH is associated with increased bone turnover or bone loss. And so that's something that's always fascinated me, understanding the physiology around that in the process. So I started adding more alkalinizing vegetables, my bone broth, mineral broth, sauteed beet greens, all these good alkalinizing foods. And that really improved and helped shift that urine pH and also how I was feeling, thinking, and behaving. And then I realized the mornings that I did my prayer, meditation, gratitude journaling, walked on the beach, my urine pH was more alkaline all day. So that's when I went to study renal physiology. Now, I did physiology research before I went to medical school. I worked with the U.S. Navy in the diving metabolism department in the exercise and respiratory physiology. So like I had the lens of this to kind of start thinking about. So I dug into some of this renal physiology and recognized that cortisol, our stress hormone, increases hydrogen ion secretion across the renal tubules. So that creates that acidic urine pH, even in the best diet. So all my vegans and macrobiotic committed clients, that you think, okay, they're eating the healthiest diet. Why their urine pH was acidic? Because they were angry, they were pissed off, they were fearful. That is that stress, cortisol, shifting your physiology, shifting the membrane potential across the cell membrane. And we see that through our urinary. We see that in the urine. We see that through renal excretion and kidney physiology. So it was like a big aha moment for me. That was so huge. So I started, and as I recognized that the times I did my practices that reduce cortisol, but more importantly, increase oxytocin. So when I'm doing things I enjoy, having fun, getting into a spiritual present process into that moment with grace and gratitude, increasing oxytocin, that opposes this cortisol level. And oxytocin being the most alkalinizing hormone in our body, known as the love hormone. It's the, hormone of labor and delivery. It helps Pitocin, if anyone listening ever had an injection of Pitocin when they were in labor, that's oxytocin. It increases uterine contractions. But physiologically, it helps us imprint on our baby. Like we're like, oh my gosh, this attachment hormone is so rich that I feel so bonded to this child, right? That's oxytocin. It's the hormone of orgasm, intimacy, pleasure, laughter, all of these good things, spiritual practices. This is so oxytocin, so alkalinizing beyond what I ate, could improve my urinary physiology and oppose the breakdown, the catabolic effects of cortisol on our system. And so that's how I started to recognize this shift. And I recognized in those of us with PTSD, even on the external, we can feel cool, calm, and collected. We've had this trauma or these adverse childhood experiences, and we go through menopause, and our protective neuroendocrine hormones, progesterone and pregnenolone, start to decline. I mean, from age 35 to 55, progesterone declines 75%. And this is our neuroprotective hormone. And so we go into this period of what's neuroendocrine vulnerability, and that leads into worsening experience in menopause. That leads into the more anxiety, depression, bipolar-like symptoms, rage. And this is where progesterone is significant we know from the research, progesterone helps build bone. So we go into this stage where we have less of the neuroprotective hormone, and this cortisol becomes suppressed. So too much cortisol too long, our paraventricular nucleus in the brain says, okay, I got to shut you down. I'm going to put the brakes on you. And now you're in this low cortisol, low oxytocin state where I say that's the energy of disconnect, the energy of divorce, the energy of burnout, the sensation in my patient's words. I know I love my husband. I just don't feel love for them. Or I love my job. I just don't feel like I feel burnout. I don't feel like going in anymore. Or I'm not social anymore, more isolated. That physiology is often where we're in this imbalanced, suppressed state. And in that state, that's leading to, a lot of degenerative diseases, and you don't feel at home in your own body. You feel disconnected from the world. And it's, for me, the most important thing that we can do is have practices that increase our oxytocin level that gets us into this state of, this state, with oxytocin, love and compassion and grace and forgiveness and gratitude. All of these things increase oxytocin. So I am big on taking the lens away from stress management and turning it to more play. I say oxyplay, more oxytocin snacks during the day, doing things that we enjoy versus I've got to manage my stress. So that's been another process in my practice, and part of the method that I teach in my programs is the practices that we do to bring more oxytocin into our life each day, as oxytocin is a rebuilding hormone. So hormone of life.
Yeah, higher oxytocin levels are associated with higher bone density and better improved osteoblast, the cells that build bone, better function of those too. So what are maybe some practical ways that the person listening could boost their oxytocin levels? I know you mentioned a few practices that you use, but are there specific actionable things that you recommend to people?
Yeah. So, like you talk in medicine about exercise snacks, right? Doing exercise snack. So I say, well, what does then, a play snack look like, or oxyplay snack look like? And what does that look like? So for my clients, part of their daily activity log is, what am I grateful for? So focusing on what you're grateful for. There can be so much wrong, but there's something we are grateful for. And focusing on that lens. And when I talk about this, I want our audience to know that I come from a place where post-traumatically, I was very depressed. I was in a deep, dark black hole, suicidal ideations. I was depressed. So this comes from a place of knowing this isn't easy for some of us. And this is a practice and a discipline that honestly has saved my life and saved the life of my family. So I say that. So, what are we grateful for? And actually each day before I even open my eyes, start my morning, I think, what am I grateful for? Where did I see love yesterday? Where was I loving? Where did I laugh yesterday? Where could I have laughed more? So gratitude, love, and laughter are ways to increase your oxytocin. It starts your physiology in a more positive way. So more alkaline, less acidic, right? Versus the old me, especially as an obstetrician, feet on the floor, running out the door, cup of coffee in hand, what's awaiting me at the clinic or at the hospital. I mean, that's high stress physiology. That will break you down. And so like before I even open my eyes, that is one of my practices. And then things like getting into nature and connecting with someone, like who did you connect with today? Like, and who makes you laugh? Who can you appreciate? How can you show your appreciation for someone in every interaction? Can you see what you like versus what you don't like about yourself and about others? Believe me, this is hard science. This is hard science. This shifts your physiology. And you can measure it. You can measure it, which is really cool. And so other things like playing with a pet, they said getting outside in nature, gardening, getting those early morning sunrises into your eyes without eyeglasses, et cetera, because low vitamin D is associated with low oxytocin. So you really need to stimulate these pathways. And, one of the things is, we've talked about for so many years, we said, oh, a glass of, the Mediterraneans, the Italians drink a glass of wine with dinner and they have long longevity, low heart disease, all this stuff. And this resveratrol in this red wine is protective. And I was like, is it the glass of wine or is it the people they're drinking a glass of wine with around the table, right? And laughing, and they're in good community and have support. So a faith practice and good community. Those are other factors that actually increase your oxytocin.
Those are great. Thank you so much for sharing those. And I know you understand and can speak to the importance of our gut health and the connection to hormones. Can you talk about that a little bit?
Yeah, absolutely. So, like I would say, I can't fix a person's hormones without fixing their gut. You have to have regular bowel movements. We have to resolve any imbalance in the gut microbiome or gut bacteria milieu because that's essential for healthy hormone detoxification and production. And we think of these things, especially as we get older. It's very common for me to see a client who's been, you know, used to being constipated. So much so when you ask the question, are you constipated? She'll say no. And then you ask the follow-up question, how many times a day do you have a bowel movement? And they'll say, oh, a day? No, 3 times a week. And I'm like, well, how long have you been like that? And like, oh, basically, all my life that I can remember. I'm like, that is a reabsorption. Toxins are being reabsorbed. There's inflammation. You're set up for a disease in that instant. And once you just get them having regular bowel movements, again, reducing food sensitivities, healing the gut mucosal lining, replenishing the good bacteria, probiotics, using butyrate often. These are things that can help rebuild the healthy gut lining. They're like, oh my God, like I've never been happier. So that's important. There's a part of the gut microbiome called the estrobolome too. And it produces beta-glucuronidase, this bacteria that produce beta-glucuronidase, which high levels of beta-glucuronidase are associated with estrogen dominance and sometimes, this concept of impaired estrogen detoxification. So we want balance in the gut. We think of increased microbial diversity is key to health and wellness. Now, because I'm a gynecologist, Kevin, I want to emphasize the opposite is true for the vagina. And the vagina is so important. Pelvic health is health, right? We need pelvic health for optimal health and longevity. Because when we have problems, I mentioned acidic urine creating bladder issues, contributing to those urgency symptoms, et cetera, or infection. As we get older, we're more sensitive to these issues. So focusing on bladder health, vulvar health, vaginal health is key. And with the vagina, we don't want increased microbial diversity because we see an increased risk of HPV and cervical cancer. With that, we want decreased. It's predominantly lactobacillus species. So addressing that issue is important. And, you're talking to me, so I always end up talking about vaginal and pelvic health. So how to bring that into our conversation.
That's so important. Are there other things related to vaginal health that you think are important for our audience to know?
Yeah, but we have to address the vaginal bacteria. Anytime we've taken an oral bacteria, if we're eating out and that animal was injected with antibiotics or swam in antibiotic, like our farm-raised fish, you're getting those antibiotics. It's disrupting your gut health, but it's also disrupting vaginal health, the vaginal microbiome. And so addressing that more and more is so important with, specifically targeted vaginal probiotics that are predominantly Lactobacillus crispatus species, Einers and Gasseri, and Gensi. So there's 4 specific strains, but Lactobacillus crispatus being most predominant and healthy, associated with healthy vagina. The vaginal pH also needs to be acidic. So using our hormone therapy, topical hormone therapy, for me, it's Julva. That's foundational. My 2 foundational products for my clients are my MightyMaca Plus and Julva. Clitoris to anus, keep that tissue healthy, around the urethra, around the vulva, all the way down to the anal tissue, because again, hemorrhoids, anal fissures, these are consequences of aging that we can prevent and turn back the hands of time to have healthy tissue. And with that healthy glandular secretions that you get as a result of this, that helps support the healthy vaginal pH and healthy lactobacilli population. So I think for me, we think of aging and we have, worried about our bones. The things in this combination between bone health and pelvic health is really important, because when you have, I would ask you, how do most clients end up with debilitating, find out they have osteoporosis, they have a hip fracture, often because they're getting up in the middle of the night to use the bathroom, or with incontinence issues, rushing to the bathroom, and they fall and break a hip. And that leads them downhill. And in caregivers, this caregiver population is that it has been surveyed and shown that the final straw is the incontinence issues, is taking care of your loved one with incontinence issues. When that becomes too much, that's when they often will put them into a assisted living facility. And so I have 4 daughters, and I had to be very strict with them through their teenage years. And I'm like, I don't want to give them any excuse to tuck me away somewhere. I keep my bladder health very much a high priority.
And Julva, so you mentioned Julva specifically. So this is one of your products. Now, this is a product that we've recommended to our audience in the past and shared with our audience in the past, and we got great responses from it. People loved it. Do you want to talk a little bit more about Julva? Hey, it's Bone Coach Kevin Ellis. Thanks so much for tuning into this episode of the Bone Coach Show. If you're finding it helpful, please leave a positive rating and review. Hit that like button, subscribe to the podcast or the channel. That lets us help more people and reach and serve more people. And it also lets us know that this is helpful to you on your journey to better health and stronger bones. And then also, right down in the show notes, you can actually find a link to my free Bone Healthy Recipes Guide. That's going to give you access to some amazing and delicious recipes to support your journey to stronger bones. And then also, we have a link to my free Stronger Bones Masterclass in the show notes too. And that is the 3-step process that has helped people in over 1,500 cities around the world get confident in their plan for stronger bones. Over 110,000 people have taken part in this, and it's been really, really helpful for them. And I want you to have free access to it too. So add your name and email right down there in the show notes, get access to that free Stronger Bones Masterclass, and let's get you confident in your Stronger Bones plan today.
Yeah, Julva I created to help clients. So without a prescription, this is a topical vulvar cream, cosmetic cream, like use it on the external genitalia. So clitoris to anus, go through a list of things you don't want to hear about that can happen if we don't take care of this area. So it has plant stem cells from the alpine rose, which has been shown to help reduce fine lines and wrinkles and improve collagen production. And I like to talk about this plant stem cells, and particularly the alpine rose plant stem cells, because this rose blossoms in the harsh conditions of the Alps, the Swiss terrain, where it's rocky and icy. And I think to see that rose blossoming and sustaining year after year under those conditions, like if there's nothing that defines, femininity as we age better than that, that is such a good example of how we optimally age, right? We withstand a whole lot of stuff. So the alpine rose plant stem cells have a lot of great science behind them. I combined it with DHEA, a topical pro-hormone that helps with, again, reducing fine lines and wrinkles. We basically see the hands of time reverse. And then there's the emollient ingredients that help increase the feel and the smoothness and the elasticity of the tissue. So it really has had so many great benefits. And I say with pelvic floor exercises, we see improved sexual function, increase in bladder control, and so many more improvements.
So we're going to make sure we link to this down below as well in the show notes. And then before we close out, Dr. Anna, anything else you think is important for our audience to know, whether it's just taking care of their general health or they're focused on improving their bones and just preserving and strengthening the structure that's going to carry them to an active future?
Yeah, I think that you and I are in line with what gets measured gets managed, right? And it goes beyond what our insurance companies will cover. And the most important thing is that we feel empowered in our own health, and using these modalities that we talk about in lifestyle, mindset, exercise, nutrition, hormones, that these are all things that make a difference and that we have control over. And so, I highly encourage everyone listening to know and have hope that you can be better tomorrow than you are today. You can definitely be better next year than you are this year. And I see it all the time, even looking at improvements in bone scans, improvements in other markers, improvements in immune function. All of these things really make a big difference. And I encourage everyone to hold on to that hope and just take your next right step.
Absolutely agree with you. Absolutely agree. Yeah, you don't have to know where every step of the path right now. You just have to know where you want it to lead and just keep moving in that direction. So I love that. Can you let people know where they can find you? We're going to put that in the show notes too.
Yeah, so I'm easy to find at dranna.com. So DRANNA.com. And on social media at The Girlfriend Doctor.
Wonderful. So we'll link to those in the show notes. Dr. Anna, thank you again so much for your time. And
Always.
for everybody listening, we'll see you in the next episode.
Hey, it's Bone Coach Kevin Ellis. Hope you found that episode helpful and that you enjoyed it. Just one last reminder, if you haven't done so already, head over to bonecoach.com, sign up for your free 7-day osteoporosis kickstart. It's going to tell you everything you need to do to start getting on the path to improvement. Hope you found this helpful. I'm your Bone Coach Kevin Ellis. I'll see you soon.